Medicare Supplement Plans Explained. If you're researching Medicare and looking for a video to help you understand Medicare supplement plans and if they're the right choice for you, this is the video that you need to see. Medicare Supplement Plans Explained. So stay tuned. Hi, I'm Matthew Clausen with MedigapSeminars.org. We are an independent insurance broker helping people with their Medicare needs from Hawaii to Virginia and Alaska down to the Florida Keys. And we represent our clients' best interests, not that of an insurance company. And best of all, our services are free to you, the consumer. All you need to do is ask. So let's get started. So this video will be different than other videos you may have seen on Medicare supplement plans. Most videos just go over the separate plans like Medicare Supplement Plan G or Plan N and so on, without ever discussing the underlying structure that's critical to truly understanding these plans and if they are the right plan for you and if they're going to support your needs. And that's what this video will focus on, so that you better understand these plans and can make a more informed decision. As you know from my Medicare Explained video, before you make any other decisions with Medicare, you must first be enrolled or eligible for both Medicare Part A inpatient services and enrolled in Medicare Part B outpatient services. Medicare Part A and B combined are referred to as Original Medicare, and from there you can make one of three choices. Now, your first choice is to do nothing. Just keep Medicare Part A and Medicare Part B, your Original Medicare, as your insurance coverage. Then add a prescription drug coverage with Part D. Of course, with just Medicare Part A and Medicare Part B and no other coverage, you have unlimited financial risk should you get sick or injured. Your portion of the Medicare cost, the Medicare bills, can still result in financial hardship. Now, most people are uncomfortable with having unlimited financial risk in the case of a medical event. That's why we have insurance. So if you have a pen and paper handy, there's an important Medicare insurance term that you should be aware of, and that term is your annual maximum out-of-pocket expense that we refer to as your MOOP. Your MOOP is the most money that you'll be liable for in medical bills for inpatient or outpatient services during any calendar year. Once you've reached your plan's MOOP, you have 100% insurance coverage for the remainder of the calendar year. Now, it's a great way to measure the coverage of one health insurance plan versus another. The plan with your lowest MOOP has the most insurance coverage because your financial risk is the lowest. So it's important to know that your MOOP never includes the cost of prescription drugs or the premiums that you pay for insurance. So insurance premiums and prescription drugs are separate. And then your MOOP resets every January 1 of each and every year. So your first choice is to do nothing. Just keep your Medicare Part A and Medicare Part B. And if you do, you have unlimited financial risk for medical bills. A medical event can result in a financial hardship. Your other two choices exist to limit your MOOP so that you have a defined, manageable financial risk, and that's important. So your second option, increase your insurance coverage by purchasing additional insurance, and you do that by enrolling in a Medicare supplement plan and use that coverage in addition to Medicare Parts A and Medicare Part B. When you have a Medicare supplement plan, Medicare pays first. Then your supplement pays all or some of what's left over. A Medicare supplement plan increases your insurance coverage above and beyond Original Medicare. So third option is to trade in your Medicare Part A and your Medicare Part B for a Medicare Advantage plan. To be clear, a Medicare Advantage plan is not a Medicare supplement. It doesn't supplement your Original Medicare. It doesn't build on your Original Medicare. It replaces it. You still must pay your Medicare Part B monthly premium to Medicare, but you're no longer using Original Medicare. You don't use your red, white, and blue Medicare card. The insurance company that you've chosen for a Medicare Advantage plan will issue you their own card for the plan that you're enrolled in. So Medicare Advantage plan is simply privatized Medicare A and B. I have a separate video titled Medicare Advantage Plans Explained that goes into some very intriguing detail about those plans. So what do most people do? According to the Kaiser Family Foundation research, more than 7 out of 10 people enrolling in Medicare choose either option 1, keeping just original Medicare Parts A and B, or option 2, adding a Medicare supplement as their secondary insurance, with Medicare Parts A and B being their primary insurance coverage. 7 out of 10 choose original Medicare. So the first question you might have is why? Why choose to add a Medicare supplement plan to your Medicare Parts A and B over your other choices? If that's the choice that 7 out of 10 people make, there must be a compelling reason. Actually, there are 2 reasons. The first is that insurance companies have no say in what is or is not covered by Medicare and your supplement. Medicare's intent is to cover everything that's medically necessary. It's not like other insurance products where they list out what is covered and leave you guessing on what isn't on the list. With very few exceptions, if it's medically necessary, Medicare's intent is to cover it. So how does Medicare determine medical necessity? They ask your doctor. Now, this is unlike any other insurance products that you've had in your lifetime. In most any other insurance that you've had in your lifetime, it's the insurance company that makes the final judgment over what is or is not covered. Insurance companies don't ask your doctor, so this is huge. With original Medicare, you and your doctor control your health care, not an insurance company. That's the first benefit. The second benefit of original Medicare that you get to keep with a Medicare supplement is that you can see any doctor or go to any hospital in the United States or its territories. You have national coverage. As long as they accept Medicare, your insurance will cover you. There's no limiting network, and virtually every doctor and hospital in the country and its territories accepts Medicare. For most people, those 2 simple benefits are the most important features of their health care. So you have the freedom of choice, choosing any doctor or hospital available to you, and you have control over your health care because your doctor never has to get their recommended procedures or tests approved by an insurance company. That's why more than 70% of the people starting Medicare today keep their original Medicare as their primary insurance. I should note that Medicare preventive care is run slightly differently than other care. Preventive care is allowed on a specific schedule set by Medicare. Some preventive care tests can be done annually, some every other year, and so on. So with preventive care, the issue is that your doctor can order a test not covered by Medicare because it's not within that time frame that Medicare advises. I have another video specifically on this subject. It's called Avoid Surprise Medicare Bills. It's an important video for anyone on original Medicare, and it's linked at the top corner of this video. Now, you should watch it, but not yet. It's also important to understand that a Medicare supplement plan is a guaranteed renewable contract. What does that mean? It means that your benefits can never change. They are guaranteed to renew each year exactly as they are now. Once you have a Medicare supplement plan, no one can cancel your coverage, no one can change your coverage or your benefits. You have that plan and those benefits that it offers for as long as you pay your premium. Not even an act of Congress can change your plan or take it away from you. Now, they can change it for people in the future who don't have a Medicare supplement yet, but they can't change yours. And this is why you don't have an annual election period or an open enrollment period for your Medicare supplement plan. Those annual periods are only for those plans in Medicare with benefits that change annually. So Medicare's position is that if the benefits change annually, then you should have the right to shop for a new plan annually. And since your Medicare supplement benefits never change, there is no need for an annual election period or an open enrollment period. You have no need to reshop your plan during any annual election period. So instead, you can reshop your plan any day of the year, 365 days a year. You just have to qualify medically to do so. If you wish to change your Medicare supplement plan outside of the initial or special enrollment period, the insurance company has the right to look at your medical history and can deny your coverage, can deny your change if you have a recent history of critical or chronic illness. And that's what's referred to as medical underwriting, and we're going to have more on that later. Now, we know the benefits of original Medicare that are passed on to a Medicare supplement plan, and this is why all Medicare supplement plans have these benefits. They come from original Medicare. So the next question to answer, of course, is by how much can a person limit their financial risk? Before we move on, I would like to ask that if you find this information helpful, please press the like button below and consider subscribing to my channel to see my other videos. Of course, also please leave a comment or question if you have one. We will answer your questions. When YouTube ranks these videos to decide which ones are displayed or easy to find, they look at how many people pressed the like button, subscribed, and commented and shared. So when you do, you make this video easier to find for others who also want Medicare Supplement Plans explained to know if they're right for them. Now, you may have noticed I do not monetize these videos. There are no advertisements. I don't generate any income by your just watching this video. I make these videos to help you understand your Medicare choices and the advantages of working with me and my agency. So please, like, share, comment, or subscribe, and reach out to us if you would like our help in selecting or managing your Medicare. Now, back to Medicare Supplement Plans Explained. Now, there are more than 10 different Medicare supplement plans to choose from, but there are usually only 3 or 4 whose price and benefits are worth considering. Within those options, you can limit your financial exposure to medical bills down to $0 or just a few $100s in a calendar year, or limit your financial risk to about $2,500 in a calendar year if you choose one of the 2 high-deductible Medicare supplement plans. Now think about that. With a Medicare supplement plan, you have national coverage. You can see any doctor, go to any hospital in the entire country as long as they accept Medicare. Plus, you and your doctor control your health care, not an insurance company. And you can limit your financial risk, your annual maximum out-of-pocket for medical bills, your MOOP, as I mentioned earlier, down to near $0. Now, one point of confusion is with the Medicare Supplement Plan benefit table and your maximum out-of-pocket, your MOOP. So let me take a moment to clear that up, because there is a lot of confusion. The Medicare Supplement Plan benefit table only illustrates an out-of-pocket limit on 2 of the Medicare Supplement Plans, and this is Medicare Supplement Plan K and Medicare Supplement Plan L. This is a poorly conceived illustration and leaves most people to believe that only these 2 plans have a maximum out-of-pocket limit. In truth, the out-of-pocket limit noted on this table is because these 2 Medicare Supplement Plans don't have 100% coverage for Medicare Part A and Medicare Part B coinsurance or copay. That's where most of your medical costs can come from. All of the other Medicare supplement plans cover those categories 100%. Anyway, as you go through the videos specific to these plans, you'll find that Medicare Supplement Plan F has 100% coverage for everything. The MOOP is 0. Medicare Supplement Plans G has a MOOP equal to whatever the Medicare Part B annual deductible is. It's $185 in 2019 and will likely be less than $250 over the next decade. So please check out the video on each plan for a lot more detail. The bottom line is that 7 out of 10 people choose Original Medicare for the unique benefits it offers, having no limiting network, no insurance company interference with your health care. They then add a Medicare supplement on top of Original Medicare so that their out-of-pocket financial exposure is minimized. So the next question you might be asking yourself is, which Medicare supplement plan is right for you? Well, first, understand that all of these plans are good plans. The Medicare benefits of each Medicare supplement plan are written into Social Security law, so they do not vary from one insurance company to another. In addition, none of the Medicare supplement insurance companies has any say in what is or is not covered or how much is paid. Medicare calls the shots and makes all the decisions. So it works like this. You go to the doctor and they're going to copy both your red, white, and blue Medicare card and your Medicare supplement card. But the doctor only bills Medicare. Medicare pays its portion and then sends an electronic communication to your supplement plan instructing them on what to pay, who to pay, when. The Medicare supplement insurance company simply does as instructed. If after these payments there's still money due, then it's likely a copay or a deductible that your Medicare supplement plan doesn't cover by design, and that would be the amount that you owe. So in choosing a Medicare supplement plan, you need to ask yourself, how much insurance do you want and how much can you afford? The Medicare supplement plan that is right for you is the one that fits both your needs and your budget. So I strongly suggest that in evaluating these plans, these Medicare plans, choose the one that you're going to want to have when you're seriously sick or injured. Don't just consider your health condition today. Once your health deteriorates, you'll not likely be able to change plans or improve your coverage. It's that simple. Now I have videos on each of the Medicare supplement plans that you should consider. Simply subscribe to my channel to find the videos comparing the Medicare Supplement Plan G and Plan N and so on. And you'll also find them on my New to Medicare playlist here on YouTube and on my website. Prices. The prices on Medicare supplement plans can vary by 100% or more from one insurance company to another and from one state to another. For example, the price of a Medicare supplement plan for a 65-year-old in New York or Miami can cost 3 times the same plan in Virginia or the Carolinas. The same can also be said about prices between insurance companies. There's no difference in medical benefits between one insurance company and the other, but there's a big difference in insurance companies, and there's a big difference in the prices from one insurance company to another. So choosing the right insurance company is important. And it's not just today's price. It's not just the price they're going to charge you at age 65. There are insurance companies who intentionally lowball the entry price for people between 65 and 70 with the intent of raising them each and every year, knowing that most people will simply stay or think that everybody's going up at that rate. The best value for you is not today's cheapest policy. It's the one that's going to charge you the least over your lifetime. I have a video that goes over the subject of insurance companies in detail and gives examples. The video is called Medicare Supplement Plans, Benefits, and Hidden Risks. And I've linked it just above my left shoulder. Go to the 23-minute, 45-second mark of that video and listen from there. You'll be glad you did. 23:45. But not right now. We're not quite done here yet. So the next thing that you need to know about Medicare supplement plans is that many states have created laws that override Medicare to the benefit of the consumer. Some states have annual special enrollment periods. Some states outlaw certain Medicare charges, which favors one plan over another, and so on. These laws can impact your decision on which Medicare supplement plan is right for you and which one's your better value. Trying to find out if your state has specific laws, however, can take hours of internet sleuthing. I know, I've done it. But to make it easy for you, we include a couple paragraphs discussing your state's rules, if there are any, in our email to you whenever you request a free Medicare Supplement Plan quote from us. So use our free Medicare Supplement Plan quote request, and we're going to provide you that information for free. So next, from this Medicare Supplement Plans Explained video, you're going to want to understand enrollment periods. The enrollment period for a Medicare supplement plan is different than the enrollment period for any other part of Medicare, and that's important. First, you can enroll in a Medicare supplement plan months before it is to start. You're simply getting the process out of the way. In most states, you can enroll up to 6 months ahead of time. In some states, it's no sooner than 90 days before your actual birthday, and a couple others, it's 60 days. But this is what's important. Your federal Medicare supplement initial enrollment period lasts for 6 months, and it starts the day your Medicare Part B becomes effective. That initial enrollment period is when you can get any plan that's available to you without any medical questions, regardless of your health. You can get any plan at the best price that it's offered. For example, let's say that your Medicare Part B starts on July 1, right in the very middle of the year. Now, in most states, you can apply for a Medicare supplement plan and get the application process completed starting the previous January 1. And you can still apply without any medical questions asked all the way up to December 31. And that gives you the entire year to complete the process, no medical questions asked. No one can deny you coverage. Now, after you've been on Medicare Part B for more than 6 months, you can still apply for a Medicare supplement plan any day of the year. You can switch plans, you can switch insurance companies, do anything you want as often as you wish. However, in order to do so, you must qualify medically. The insurance company that you're applying to has the right to deny your request if your current or recent medical history shows any serious critical or chronic illness. They can deny your request, and in which case you just keep what you have. 3 important points to build on this. One is, don't assume that your health condition, if you have one, will disqualify you. You can be 2 years cancer-free or had open heart surgery 10 years ago and still qualify. Now, every insurance company has a different set of underwriting guidelines. But we help with this, so just ask. So 2, an insurance company is very likely to request underwriting even if you're changing plans within the same insurance company. That's standard. If your insurance company says that they'll let you switch plans at any time without underwriting, be careful of what they are not saying. What they're not saying is at what price. They leave you to assume it's at the same price as if you qualified medically. It's not. Those companies have a separate price table for non-underwritten changes, and it's much higher for people who switch plans without underwriting. I know, I work with these companies. Of course, some states have special rules that allow a person with a Medicare supplement to change without medical questions, as I mentioned earlier. 3rd, there is no annual election or open enrollment period for Medicare supplement plans. Now, we mentioned this earlier too, but it's important enough to repeat. The annual election or open enrollment period only pertains to Medicare Advantage plans and Medicare Part D prescription drug plans. And the reason is because the Medicare Advantage and Part D plan benefits change annually. Your Medicare supplement benefits never change. And lastly, in most states, you can become subject to a period of pre-existing conditions when switching a Medicare supplement plan. Now, this confuses a lot of people. So please understand, it's very easy to avoid any pre-existing condition clause because one of 2 conditions must exist before you can be subject to any pre-existing conditions, and it must be outside of your initial enrollment period. First, you must have a gap in your Medicare coverage of at least 63 days, or if you try to switch your Medicare supplement plans without holding on to the first one for at least 6 months. Now, one of these two conditions has to apply after your Medicare supplement initial enrollment period in order to be subject to pre-existing conditions. Now, there are even further restrictions, but it's really too much for this video, and that's something that's best consulted on a one-on-one basis if you have a concern. So there it is, Medicare Supplement Plans Explained. Your next step is to either check out my Medicare Advantage Plans Explained video or one of the other videos on some of the specific Medicare supplement plans that I mentioned earlier. So now it's your turn. I make these videos for you. Now, YouTube ranks these videos based on the number of likes, comments, and people who subscribe. So if you found this video helpful and you believe that others would find it helpful too, please press the like button, hit the bell icon, and that way you'll be notified when I do publish more videos. And then please leave a comment or a question, anything. Let me know how you feel about this video, or if you have a question, please share it below, but just don't leave anything personal. And when you like or comment or share and interact with this video, you help others who would benefit from watching this just as much as you have. So I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.